Thank you all for being here this morning for a workshop of the Children's Trust Board. I want to now call it to order and just remind everyone, all of us, so we're centered in the mission of the Children's Trust of Alachua County, which is to fund and support a coordinated system of community services that allows all youth and their families to thrive. Any member of the public wishing to be heard will have that opportunity in just a moment to come forward to the podium, introduce yourselves, and be recognized to have 3 minutes on any single subject matter or to address a current motion on the floor. We do have a couple of major topics, obviously, this morning for our workshop. The clerk of the trust will serve as our official timekeeper. Please do be reminded that our policy prohibits any unplanned funding requests from the podium. Should a member of the public wish to make a funding request, please contact our executive director or staff for consideration. The clerk will now call roll and verify that there are at least 5 members of the trust physically present for today's meeting, and board members are asked to green light and speak directly into your microphone.
Thank you. Member Tina Certain. Here. Board Chair Mary Chance.
Here.
Member Ken Cornell. Dr. Nancy Hart, member.
Here.
Dr. Maggie Labarda, member.
Here.
Dr. Kamala Patton, member. Treasurer Lee Pinkeson.
Here.
Honorable Suzanne Wilson Bullard, Vice Chair. And Member Melissa Walker. That is the roll.
Thank you. Okay, we'll now move on to the approval of the agenda, including any revisions that we have in the agenda before us, which is the strategic plan presentation and a discussion on the funding allocation framework.
Move approval.
Second, any comments before we bring that to a vote? Okay, all in favor? Aye. Thank you so much. All right, now is our first opportunity for any general public comments at our workshop. Thank you. Please come forward.
Okay, I actually did quick into the meeting. My name is Ross Ambrose. Some of you would recognize me because I was a nominee to sit on this board when it was first formed. The governor took a year to appoint, and during that year, I was one of the people that attended every one of the meetings. During that year, I live in High Springs, and I'm not associated with any particular organization, but I have funded some that you have also supported. But during that year, while it was being discussed, how would this money be spent and what would be done, there was an analogy used about the often programs were focused on fixing the sick fish that came out of the lake versus making a healthy lake. And in this last year, I think there have been some gaps in how you've organized the opportunities for organizations to be funded. And one of them I'd like to point out is in rural High Springs, there aren't a lot of things available, including public transportation. And the trust provided seed funding the first year to start a program there, a robotics program that does a whole lot more than teach kids how to work robots. It uses robots to teach kids. And your funding not only allowed them to get started, but every year that they grew, they expanded their capacity. They, in many cases, went 11 months out of the year. They increased their volunteer base. They brought in private funding. So the seed funding was really being leveraged. And this last year, the way the programs were designed, they didn't qualify for a dime. They did come up with some money when they qualified to go to a national competition. They've actually been invited, different teams, to go to international competitions, and they've been successful at the state level every year they've been involved. But the program really doesn't focus on robots. It focuses on core values. It's really a peer mentoring program in a lot of cases. But it didn't fit the model of mentoring. Parents, the school teachers, the youth themselves and their peers have reported a huge change in how these kids act outside of the program because of the skill it teaches. And when I'm done, I'll pass around a sheet of the core values. And I just really would like to emphasize that there may have been a failure in the design of funding. If a program that's being successful and is being impactful and is addressing many of the values that are in your current strategic plan, G1, special needs, G2, literacy and academic success, G2, safe spaces, G3, prevention, and G4, capacity building, and yet last year they weren't able to receive funding. I really just would encourage you to look at that. And also, and that's a safe space in the lake. It's working. So let's continue to find ways to support those types of programs. But also, it was discussed about how the Children's Trust of Alachua County would be different than other trusts. And I'm almost done, and I might go about over the 19 seconds, and I hope you'll allow me a few extra moments since your rules do allow that. But capacity building would be very important. Multi-year funding and commit to organizations. And if you're going to sunset that funding, maybe put into place some support organizations, especially smaller organizations. You're going to hold me to the 3 minutes, or will the chair allow a few additional minutes as your rules allow?
15 seconds.
Okay, your rules say potentially up to 10 minutes, but I don't want that. I'm only looking for about another minute and a half, maybe?
Sure.
Okay,
We do have a full morning, but that's.
I do appreciate that. But the capacity building, and if you're gonna wean programs off of that funding, then do it in a slow way, where they know that that's happening and they find methods to do that. I've appeared before you once before, and I said, one of the barriers that you have in a lot of the programs you wanna fund is the reimbursement, and that's the way government works. You gotta make sure the money's spent. But why don't we work on creating a model where there's performance bonding? And so you can seed fund money up front, and if they don't perform or they spend the money inappropriately, the bond pays the taxpayer back for the money. You'd have a lot more opportunities to work with smaller programs. And I also think the organization should take a look at lobbying, changing the state rules that don't allow you to fund programs that support parents that impact directly youth. You know, I mean, why not have a way to fund programs that teach parents how to be good parents or allow them to support their young people? But right now you've got that barrier where you have to make sure the funding directly goes into youth. Yet that doesn't allow you to be creative. So I think the trust should look at some of those innovative ways they can impact the communities and make sure that you're providing opportunities for all groups to be well-funded. And I'll pass out the core values and I will sit down. Thank you.
Wish to come forward to make a comment? Absolutely.
I apologize that I did not catch your name. Was Mr. Ross? Thank you for coming up and sharing your thoughts. Thank you for your care and concern for the community. The program you were mentioning, I believe, was Swamp Bots. And we funded them through what we consider to be an innovation grant. It was a one-year pilot grant. So the requirements for that are limited. They are not as stringent as it is for our multiple year funding. Additionally, they received a good bit of support from the trust. So what I would like to do is love for you to schedule a meeting with us to talk more about some of your ideas, for you to hear what we did do, and then hear what's upcoming, because there will be requests for proposals for, as we're going to talk about, prevention, which does include mentoring, that particular organization would be encouraged to apply for. So I don't think we're as far away from what you were describing and what you were discussing as maybe you think we are. So we would love to have a conversation with you. Thank you, Madam Chair.
I do remember those coming to a board meeting as well, I think sometime last year.
Real quick, and I'm sorry I'm late. Ross, thanks for being here today. For those of you that don't know, Ross was one of the gubernatorial appointees when we stood the trust up for the first 3 years and attended all of the meetings, literally all of the meetings before the governor assigned. So I appreciate you being here and your investment in the trust.
So much for being here. And anyone else to make a comment? All right, I think we're ready to move into.
I see our dream team is here, C. Robinson and Associates. Who's taking the lead this morning? Miss Jackie will kickstart us with our strategic planning. So board members, if you have your packet, if you will turn to tab 12, you will find a copy of the plan.
Good morning.
Morning.
Thank you again for the opportunity to be with you today. We're genuinely excited about where we are in this process. And as you know, what began as a refresh of the strategic plan really evolved into a much deeper effort as we worked through multiple rounds of research, discussion, and refinement. Along the way, your guidance and engagement helped shape the direction of this work. The staff and the project team have invested significant time to ensure that the final product reflects both your vision and the needs of the community. So today, we're going to walk you through several key elements of the draft plan. We will briefly revisit the journey that brought us to this point and how the plan has evolved through several iterations. We will also highlight three, actually, important additions that emerged from the work: a new goal focused on provider capacity, recognizing the importance of equipping and strengthening providers to deliver services and with excellence and consistency, and an added focus area dedicated to children with special needs, ensuring that this population receives the attention, resources, and support it deserves. Throughout the process, staff and the team worked intentionally to develop a plan that is not only aspirational, but also measurable, one that clearly defines indicators, objectives, strategies, so that progress can be tracked and outcomes can demonstrate real impact across each goal area. We want to thank you again for your thoughtful engagement and direction you have provided along the way. Your input has been instrumental in shaping what you will see today. We look forward to sharing the final draft with you and welcome any final feedback you may have as we move forward to approval of this plan. I will give a high-level overview of the focus areas, indicators, objectives, and strategies. I will then turn it over to Amy and Bonnie to take you through any details that you desire to discuss. Okay. All right, so let's talk about the journey. Next slide, please. Okay, here we go. So as you know, I mentioned that there were several iterations, a lot of research and discussion and refinement. This process started in June and July of last year, where we worked closely with staff and we worked closely with the board in individual pre-work interviews to kind of get your take and your input on where this CTAC needed to go, where the trust needed to go. So we did that in June and July. That led us into an initial workshop with the board in July, where we had a presentation on life cycle stage of a nonprofit. We reviewed CTAC's current state, and we talked about what we need to consider for future focus areas and goal areas as we plan this strategic plan. Then staff went to work to develop some focus areas and some impact measurements, recommendations for goals 1 through 4. We returned to you and talked about what those focus areas were, what our recommendations were, what the impact measurements were. We got additional feedback from the board. Staff realigned the strategies and measurements at that point. We also asked you for some additional information through a survey that we distributed to you, and that set us on the path for where we are now and what we presented to you in January. In January, you had some discussions about evidence-based data and the rationale for what we were doing. We went back, did some additional research, and updated the focus areas and the monitoring progress plan, which you will see in the back of this presentation. And this brings us to today's workshop. You want me to take the? Okay, somebody else doing it, or you want me to? Okay, next line. So what we've done is this plan is set up to be public-facing, a public-facing format. We believe that it makes it easy to read, to digest, and to understand the direction of the CTAC organization. So what you have first is a purpose. Your mission stayed the same. We did revise, in your first workshop, we revised the vision to read, all children, youth, and families in Alachua County reach their maximum potential. That is the new vision for the organization. Your guiding principles, 1 through 10, which is how you will be guided to make your decisions throughout this process, remained the same. Next slide. What you have here is a table of contents at a glance and an executive summary that really summarizes the contents of the plan. This updated strategic plan reflects, and if you see there in bold on your right, some of it may be on your left for some of you, this updated strategic plan reflects a refined vision and clear strategic priorities aligned with current and emerging community needs, expanded goals and measurable objectives, enhanced operational strategies to improve efficiency, coordination, and service impact, stronger community partnerships. You will see those throughout this process, who and what partnerships we need to make this plan successful. And a phased implementation roadmap, recognizing the increased scope and complexity of the work ahead. Next slide. So here you have your goals and your focus areas. 3 of your goals remain the same. Goal 1, children and youth are healthy and have nurturing caregivers and relationships. Goal 2, children and youth can learn what they need to be successful. Goal 3, children and youth live in a safe community. And your new goal, Goal 4, empower and equip our provider community. Each of your 4 goals then have focus areas that will drive those goals. Under Goal 1, which we're calling your health goal, you have 4 specific focus areas. Under Goal 2, there's 2 focus areas. Goal 3, 2, and your new goal, there are 2. And I'll go back and read those. Under Goal 1, the first focus area is pre- and postpartum family health, is where we will focus. The next focus area is infant and early childhood health, then comprehensive health, youth, and children and youth with special needs, which is your new focus area. Under the education goal, you have early learning and a focus area that we spend a lot of time discussing, literacy and academic success. Under Goal 3, your 2 focus areas are safe spaces and prevention. that CEO Marcia just mentioned about some prevention-type programs, so prevention programs and prevention plans. Then under your new goal, you have provider capacity building as well as CTAC, the internal organization capacity building. Next slide. This slide defines the implementation roadmap. This is a 7-step structure that moves the goal and the focus areas from vision to impact. And so what you have here is your goals. It's a pictorial. You have your goals and your focus areas in the center, and off of those, there are 7 steps that the staff and the team went through to get to this plan. We looked at our indicators, what we aim to influence. Looked at rationale. That's our evidence-based data that we had a lot of discussion on. Then our objectives, specific targets that we want to achieve. Strategies, our high-level approaches that will drive those objectives. And then our implementation plan are our actionable steps and tasks. Key partnerships, those organizations and stakeholders that are critical to the success of this plan. And then our measurable outcomes reinforcing commitment to those outcomes through transparency and accountability. So it's a 7-step process. So now let's look at the next several pages will encompass those specific focus areas, and I will only go through the indicators, objectives, and strategies, and then if you want to discuss further rationale or the implementation plan, Amy and Bonnie are prepared to walk you through that. So, under focus area number 1, under the health goal, we have pre- and postpartum family health. Our indicators here, pregnant women feeling down, depressed, or hopeless, and low birth weight babies. This is what we plan to influence. What we plan to achieve are parents are mentally healthy and supported. And then our high-level approaches will be to provide mental health services and support, provide navigation to connect parents to services and resources, and provide parent groups to support learning and community building. So those are your high-level strategies. Under focus area 2, infant and early childhood health, you have indicator there, verified findings of child maltreatment and developmental screening. So there are 2 indicators there. Objective is children are nurtured and developing, and then our high-level strategies are listed there. Provide family support programs, which include home visits, postpartum doulas, family resource center services, and more. And then connect parents to services through navigation programs and enhance utilization of child development screening and connection to early intervention where needed. So the next focus area under our health goal, which is goal number 1, oral health, youth felt sad or hopeless, and physical health. Those are the indicators that we will be aiming to influence. We hope to achieve an overall children and youth are healthy. Overall children and youth are healthy. And then your strategies are listed there. Access to mental health and behavioral health services, access to dental services, and services and programs for physical health, fitness, and wellness. The next focus area, children and youth with special needs. This is your new focus area. And this is one of the areas that we will be seeking to obtain more data as we go forward, since there really are no measurements, or very few measurements related to this. Our objective is children and youth with special needs have access to quality programming, and then the strategies are listed there. So we will start with evaluating supports and resources available for children with special needs. So there will be an evaluation process. Then we will involve parents, caregivers to determine the needs and solutions. So we will listen to our caregivers and our parents to hear what they are saying about this particular area. We will convene our critical partners, professionals, and parents to determine opportunities to add, expand, or enhance this program. We will introduce additional services, programming, and supports for children with special needs. Once we get all of that information, then we'll have a direction to introduce additional services for this particular area. Goal 2, our education goal. There are 2 focus areas, as I mentioned before, in this area. Early learning. The indicator, what we want to influence, is kindergarten readiness and VPK participation. We want to achieve children entering kindergarten are ready to succeed. And our approach is to improve access to early child care and education, and to strengthen and enhance quality of early child care and education. Under our literacy and academic success, we want to influence 3rd grade reading and math proficiency. We want to achieve children meeting or exceeding academic standards, and then our approach would be to support those programs with evidence-based literacy components and to facilitate access to impactful academic reinforcement. We have, you want to,
Would you prefer questions now or wait till we're through?
if we can get through the 4 goals and then okay, that would be great. Okay. Goal 3, focus area, safe spaces. Our indicator, what we want to influence, is high school graduation and school disciplinary incidents. We want to achieve children and youth having a positive and safe place to learn and grow. Places to learn and grow. And then our approach, we will provide a coordinated network of out-of-school programs and promote awareness and skill development in programs such as self-regulation, conflict resolution, planning, and more. Under the focus area of prevention, school safety incidents, and youth arrested. We want to achieve children and youth building positive decision-making skills as well as positive relationships. Strategies, we will fund programs with evidence-based models shown to prevent juvenile delinquency or related risk factors. We will also provide opportunities for youth to build positive relationships with caring adults. And then our 4th new goal, agency capacity building. We aim to influence, measured by the number of program performance targets met. And this is an area too that we need more data on, that we will be seeking to do exercises to obtain that data. It says 81% in 2024. Agencies with diverse funding sources, the number of funded agencies supported with funding outside of CTAC. So we will be looking at our partners, at our providers, to also encourage them to seek funding outside of the CTAC organization. And then collaboration, agency collaboration among CTAC-funded agencies. So we want the collaboration to go on between our partners. The objective, providers are equipped to be successful. This is all about improving the success of our providers. And then our approach, facilitate engagement of programs in an organizational capacity assessment. So we will do an assessment of the providers. We will promote training opportunities to strengthen program, and this does include, far and foremost, meta training opportunities. And then we will facilitate collaboration among the funded agencies. So we will be involved in promoting this collaboration. And then under focus area 4, under goal 4, the next focus area is CTAC capacity building. So we're going to look internally. We're going to look at this organization and do a capacity assessment and get feedback from our providers and our stakeholders. Our objective here is the Children's Trust staff and systems operate efficiently and effectively to deliver its mission, to fund and support a coordinated system of community services that allows all youth and their families to thrive. Our strategies related to this focus area: we will do a regular evaluation of our administrative systems in each department and develop an action plan to update the systems as they are needed. We will provide ongoing opportunities for feedback, so we will be talking to folk from the CTAC staff to you, the board, our providers, community members, and other stakeholders, our partners as well. So those are our 4 goals, and those are the focus areas related to those goals. And I will be happy to try to answer any questions that you have at this point before I turn it over to Bonnie and Amy.
Thank you, Madam Chair. So I think this is really actually great. I don't know if I have any specific questions. I do have a couple of comments. I think on goal 2, when we talk about focus area literacy and academic success,
Yes.
I'm really glad to see that we've got the reading and the math. I think that makes a lot of sense. I think one of the things that we have talked about for 2 years, and I'm going to give my member certain kind of credit for this, is the importance of the school board as it relates to this goal. So I think we need to add at least some mention of collaboration with the school board.
In the back. So this was the high-level overview.
Yep.
If you go to the
Oh, thank you.
specifics,
Correct.
page 161, we'll talk about key partnerships.
Key partnerships, they're listed.
Page what of what? Page 13 of 21.
161 in the back, yeah.
I was just saying on page 161, 13 of 21. This is where
So
we
we have
get
the
into
school
the
board,
specifics.
we have the library district, New World. Yeah, I think that's great. Okay.
Those key partnerships there, yes.
Yeah. Okay, so that's good. That addresses that. And then on goal 4, I think 2 things. First of all, when we were talking about, let's look at ourselves first, as far as the life cycle, that makes a lot of sense. So I would actually literally move that first, and then put agency capacity building second.
Okay.
But for my members, what I would say is that while that makes sense, we aren't a nonprofit. We are an institution. We are a special taxing district, and we don't have that same life cycle. We literally have a 12-year life cycle, and then we either have another one or we don't. And so I don't want us to get hung up on, we like, right? We were a startup, we're in growth right now. God bless the taxpayers if they get us to maturity, okay? That's my feeling. But I don't want us to get hung up on, we have to do ours first, and then we want you all to figure out where you all. I think we need urgency on the agency capacity building. I don't think it changes our plan. I'm just really talking to my colleagues from a workshop perspective, because we're going to get to a conversation about funding eventually. And we're going to be talking about how does the county do it, how does the trust do it. And This, to me, is where we need to spend most of our time when you say it's the right time to have that discussion. Because I want our partners, our agencies, 75, to hear this board say, dive in and dive in fast. This is not a 3-year test. Because in 3 years, we're back out. Renewal is in renewal. And so, and I've also said lots of times, we talk about what's important, but we fund our priorities. And I am ready, as a board member, to make capacity building a funded priority for those organizations that are interested in capacity building. Because I don't want the trust funding 100% of these organizations. That's not sustainable. It is for a startup, but if we have 75 startups, that's not sustainable. It just isn't. And so I don't know if that's for today's discussion in the workshop or if it's for a later discussion, but I'm ready to have that discussion. Thank you, Madam Chair. So that, my only change is just.
Flip it. Okay. Yes, sir.
So follow up to what Ken was just saying. Thank you. I'm not sure what time. I'm not sure what time it is quite now. I think this reminds me of all grant applications where there's always a section you have to respond to is, what will you do at the end of the grant to continue this program? To which my first reaction was always, well, if I knew that, God bless it, I wouldn't be applying for this grant, right? I'd have figured it out and done it without all this extra work. So I think if that's a goal, and I agree with you, if this program's important and we want it to survive the potential demise of the trust, then part of our investment needs to be, well, how do you do that? Fundraising, because there aren't a lot of sources of revenue. Let's just be really crystal clear that there aren't going to be a lot of governmental entities funding these kinds of services if the trust goes away. There aren't going to be opportunities for Medicaid or anything else to fund a lot of these outside the norm healthcare initiatives. So if we're really serious about that, then we've got to figure out and help them figure out what is that other source of funding. This is a limited fundraising community.
Yeah.
So I think we need to be realistic too, that there is limited capacity outside of the trust for some of these services, which is why we created and created the trust, right?
Oh, I'm so sorry, I didn't
Are
see.
we not going in order?
Oh, that's okay. Oh, no, they were.
Are you gonna follow up on what?
All right, thank you, Madam Chair. I kind of want to go back to what Member Cornell mentioned about the district being a partner. And I think we need to make sure that the school district is really, that they are kind of the premier partner. Because I think it's unfair, I'm going to say this again, it is unfair to put the burden of academic improvement on an after-school or an outside educational organization. Yeah. Students are in school 6.5 hours a day, and the school district is the primary agency or entity that, along with families, that's charged with that. So I don't, because I'm hearing some bubblings up with this literacy thing of there being, like this burden, I for lack of a better word, it's early and I'm not thinking real good today because I was up too late last night, but that there's this added layer of scrutiny and responsibility being put on out-of-school time providers. And now, there's some organizations that are doing some good work, but I don't want us to really put all of that, because there's only so much that they can do in the 1 hour to probably 3 hours that they have kids every day. And you also got to remember that the kids are coming after school. So that's that. And then to tag on to what Maggie and what Ken said, I do agree we fund our priorities. I do think we have to have urgency within our agency as well as with the providers, right, to show our worth and our value to the community, since we'll be going out for renewal. I mean, when you start to look at it, we on the clock for 4 more years here, you know?
The campaign starts now.
Exactly, right? And so, but I'm hoping all the good things that we've done in the past 8 will be enough, you know, to carry us on for the next 4. But where I wanted to go with that is, like I saw a bullet I was looking at this a little bit it said that there's a 25% reduction in funding or proposed, like that's just something that's in here, right? And we do want people to have the urgency and to get going. Maggie is correct that there's a limited amount of funding that's in here, and we also have to realize the political landscape or the landscape of where we may be with this whole property tax thing outside of trying to get additional funding like through grants and other areas. So I think we gotta kind of and the board is not dealing with providers every day the way staff. So I kind of want you guys to keep in mind to know that as we're trying to tell agencies, providers to be more proactive is that you all have got to do that as well, along with the board. I mean, people may not think of it like that, right? And that we can't just tell agencies, well, we're not going to be here to fund y'all for your entirety, to which they may say to y'all, well, we might not be here to fund y'all, so so we kind of like to end this thing together, and I want us to really embrace that, and it's not us against them, and all. We got to work collaboratively to do this thing. I mean, just like we work to get this tax approved, we got to work collaboratively together if we want to keep this going, to do the good work, because believe it or not, if it sunsets, it will leave a bigger void in the community than there was prior to that, because we have had this, kind of like if you're used to eating lunch at school, and then when COVID came and there was no school lunch, as bad as it was, I had kids to tell me, that food was bad, but we did miss it. So, so it might not be the best, and we ain't doing everything right, but when you take it, it might not be there. So, but thank you all for the work you're doing.
Thank you. Thank you. Yes, collaboration is going to be huge, critical in this process.
Member Hart.
Okay,
Okay, so I got a couple of things. On goal 2, which is our learning focus area, there's no mention of attendance. And I think that there's really, as Tina points out, some magic that happens in those 6 hours at school. And if the kids aren't there, it's very difficult for our providers to make up for that. And so I would like us to figure out a way, and this just puts one more burden on the staff, sorry you guys, to figure out is there any kind of a campaign we can do to encourage attendance at school, either by supporting parents to help them get their kids to school, which can be a huge challenge when they work a shift that doesn't allow them to be home when the kid has to get on the bus. I mean, I totally empathize with these parents. Anything we can do to increase attendance, I think, is important. And I also noticed that housing didn't show up in goal 1, 2, or 3, and the deeper I dive into the housing problem for families with children and all the impacts on the children, if we're just looking at what happens to the children, I think our community doesn't do a terrible job of looking at the parents, but nobody looks at the kids. And what happens to the kids is they don't go to school, and they don't learn to read. And if they don't learn to read and they don't graduate from high school, they wind up in juvie, and then they wind up being homeless, and then they wind up having homeless children. So it's a cycle, and I really want us to see if we can't dive in somewhere related to housing. And I loved whoever it was, I think it was you, sir, that suggested we need to do some advocacy in Tallahassee to see if we can do more things for the parents of children. And one of the things that we could do is more strongly advocate for our local housing policies to prioritize families with children. And I'm thrilled that we've prioritized veterans and people with disabilities. That's all great. I wouldn't want to take anything away from them. But when you look at what's going on with our housing authority, they use the HUD criteria for homelessness, and that doesn't get at the kids. Remember that of our 1,000 children who are not stably housed in our school district, over 700 of them are couch surfing or doubled up. And those children are one argument away from being nowhere. So we need to consider that as a safe space, is where they sleep at night. So anyway, that's my soapbox for that. And I did have one other question, which I liked a lot, in infant and early childhood health, goal 1. Developmental screening is one of our indicators, and I love that indicator. But who's going to do it? Because, you know, Medicaid's kind of crumbling. A Medicaid provider would normally do it. The mobile clinic doesn't even do it. Are you kidding me? We don't have much kid care in our free clinic. So I'm really worried about that. I think it's a great indicator, but who's doing it?
Early Learning Coalition, it does 2 screenings each year on children who qualify for school readiness. So all those kids that get the Early Learning Coalition subsidies will be screened. And we also fund the Help Me Grow, which is available to all children 0 through 8 in Alachua County. They can go online, and every single child in this county can have their parent do a screening and then speak with our child development specialist. So it is something that we fund, and we'd love to see the reach increase on that. So starting to measure that as a baseline in partnership with the ELC, who is now doing the bulk of them. But we also are doing some screenings through Help Me Grow, which includes the ASQ, the Pediatric Symptom Checklist, and the MCHAT, which is a screening for autism.
Okay, all that's really good. Yay.
It would be lovely to see if we can impact EPSDT rates.
Well, I mean, I'll take what we can get, really.
No, I will too, but I'm just saying it'd be just lovely to see if we could touch EPSDT, but.
And then one other thing about goal 4, I got a little bit confused about the terminology agency. Are we talking about our providers? Because
Yes.
what's the difference between an agency and a provider? Is it the same thing?
Same thing.
Okay, thanks. That's the end of my confusion. Thank you.
Member Ferguson.
Thank you, Madam Chair. Because I missed the meeting on the 26th, I think y'all did a great job, especially including math. Thank you, Member Cornell. My questions are more later on, so I'm not sure, about how because I think what's going to make or break our success are the measurables and the performance measures. I have some questions about, y'all laid out things in the back about measuring the results. My question is, how are we going to do that? Because some of them seem kind of vague as far as who's going to do that. How are we going to compile the data? Like when we do a referral and say we want to know whether the referral worked, or who's going to come back and tell us that that referral worked? Because we've set standards 80% or whatever it is, but how are we going to get the information that we need so that we can go back out to the public and say, look, here's what we do, and this is why we should exist. We are making the difference.
Bonnie or Amy, you want to fill that?
So a couple of those programs that we have now that we currently fund are the Family Resource Centers and the Maternal Access Clinic. So that's part of what they do in their data requirements, is that they collect data on who they refer to and whether that connection was successful. Help Me Grow also has a referral process. So we combine and we roll up the data from all our different programs to have a master performance measures that looks at all our programs combined.
I have one thing, and this may show up later, but in the more detailed part, under goal 1, the last area, children and youth with special needs that we've added.
Yes.
I just want to be sure we're also talking about, I see about convening providers, but I don't see anything about measuring the focus of existing programs to serve kids with special needs. This sounds more like standalone serving kids with special needs. We've heard from providers in the past they've talked about they do serve kids with special needs. So like, can we help strengthen their ability to serve kids with special needs and measure how they're doing that and be explicit about it? And then on goal area 4 with CTAC capacity building, when I read regularly evaluate administrative systems, I want to make sure we're also talking about like standard operating procedures, how we do things, not just like what software we use, or that we're talking about developing and reviewing standard operating processes and procedures.
Yes, my understanding is it's all encompassing, yes.
And and so I might, just to give some weight to that, on goal 4, where we have at the front, empower and equip our provider community. I might add, and build sustainable structures for CTAC, ways of doing things. Those do go hand in hand. Empower and equip our provider community and build sustainable structures for CTAC. How you work with providers, how you do things, because that's what I'm hearing. But to me, they go
I like that a lot.
hand in hand. Empower and equip our provider community. I'm sorry, I'm on page, right at the very top, the title. Empower and equip our provider community and build sustainable structure.
And that will become the goal itself, correct? Yes, sir. Yes,
Talk
ma'am.
about it in the strategy.
Yes.
Else. Sure.
Goal 4.
Goal 4, empower and equip our provider community is what it currently says, but it doesn't say anything about CTAC. So I'm suggesting adding and build sustainable structure. Yeah, that makes sense to me too.
Mask on your face first.
But they're, to me, they're interlocked, they're interwoven.
Thank you, Madam Chair. I just want to address, Dr. Hart brought up something about the housing. And as we know, this is a living, breathing document. And I noticed in our regular packet, the referral about housing, about the crisis mode as far as housing back to staff back in November. And they're going to, and it says that it's in progress, and they're going to bring something back. I think right now, we're going to end up probably doing something, most likely aligning with the county commission, because dollars for housing than we do. But that's something that we need the information before we really get into it. Update for the strategic plan next year. I would imagine it's going to, that magic word collaboration, it's going to be more hopefully the referral process. Thank you, Madam Chair.
So maybe, if we're talking about special needs kids, housed about that. I've got it. I'm on the mic. Okay, just like do I just so maybe as we look at and convene special needs, we might want to ask about housing as part of that whole process of looking at kids that have needs that other kids might not, because housing makes you vulnerable in all of those areas pretty much.
Thank you, Madam Chair. So is our goal this morning to make these small changes so that we can adopt this afternoon? Correct. Okay, and so my big thing for us to talk about, which is, you know, the goal 4 and the funding and how we do all that. When I look back at page 18 of 21, similar to how Marcia referred to me on the literacy thing, I think we kind of capture it there. With regard to, so, I'm sorry, so, yeah, so this would be 18 of 21.
If you're in your book, it's 66 and 67.
Yeah, so we've got the indicators, which is measured by the number of program performance targets met, and then the rationale, and talks about collaboration and multiple funding sources. I think we can have, kind of approve this, but then have that, how do we implement the strategic plan? We're doing that at a later date, I presume. Oh, all right, so we'll get to that at the next comment. All right, so then I think all we really need is a motion to change goal 4 and to flip goal 4's first and second,
Correct?
so that when we get here tonight, we can adopt that plan, unless there's any other changes. You need a motion for that, or are you just gonna take that direction and then? We'll take that direction. I would move that we make, Chair Chance's change on goal 4, to add and build sustainable structure for CTAC, and that we just switch the order of goal 4 focus areas.
I'll second.
So we can adopt this tonight.
I do have a discussion question. Are we including the monitoring plan as part of the strategic plan, or are you seeing that as a separate issue?
Would you please use your mic?
No, the monitoring piece. So, because we stopped
not
talking
the
at
funding.
the point where we went through the goals, strategies, objectives and strategies. Are we also approving as part of the strategic
Yes.
plan?
The details.
Monitoring our progress?
Yes.
So do we need to hear about that before we?
If there are
From goal 4's
questions or
perspective,
discussions, we can. But yes, it was all a part of one.
I like the words, back to my point on 18 of 21. I really like the words. Agencies need to maintain multiple funding sources to reduce reliance on any single revenue stream and promote long-term stability. That's it, as far as I'm concerned. How we implement that and how we fund agencies that do or don't do that is the next discussion, which that says, and then we'll have that discussion. But I think from adopting the plan, that sentence hits it.
Because we didn't talk about any of those subsequent pages, so I just wanted to make sure we all realized what we're approving the totality.
No, so, I guess I'll wait till we come to the funding, till we talk about funding. I won't get bogged down. Go ahead, that's okay.
Executive Director Kiner?
I was just going to add, so the front half of what Ms. Jackie so wonderfully provided an overview of, that's forward-facing. The second section is how we get there. So it is important that if you all feel we need to walk through this section, that we walk through this section. So if we need to take, it's just 10 o'clock, we have a little time. However, I don't want to go too long that we do not get into the funding discussion, because it is just as important.
Well, I just want to make sure some of the things that we mentioned to be added, get added into this language, because once we approve this, I would not blame staff if they didn't go back to the other thing and they just went forward with this. They put a lot of work into this, it's for sure.
Yes, and we will bring the finalized piece that we do today to you at the April meeting so that you can see a cleaned up version of it.
This afternoon.
Well, this afternoon, you'll vote on it, and then we'll clean it, and like there are some things that look, some formatting issues.
I guess I would advocate spending, a limited amount of time to go through this and make sure we've added a couple things here and there that we just talked about. That's my feeling.
Shall we do that now while we have a motion on the floor? When shall we invite any public comment on the plan? That now on the high level? Any public comments on what you've heard so far about the draft strategic plan or proposed? Hiding back there? No. Thank you. All right, then I think we've got Bonnie and Amy to take us through the details. We are at tab. Oh, no, it just continues. Got it, never mind. Sorry. Monitoring our progress section.
Maybe what I would suggest, Madam Chair, is hearing the comments you just heard from Member Hart, could we just focus on what perhaps we could add into the wording for those areas to address housing and attendance? All of them, we can just kind of focus in on that. Is that right?
I'm just commenting on your gift for good listening. That could be why you're the chair of the county.
Wrote it down, attendance and housing. Yeah. Where would you recommend we kind of implement?
So I was gonna kind of just go through the first page, just to kind of talk you through the format, and kind of what we were thinking when we put this together. And then I was going to go over the new ones, which was, special needs, and then goal 3 and 4, which were the prevention and the, don't do
I
that.
don't think we need to do that.
Okay.
I think we need to just hit the pieces that they've pointed out
Okay,
to save time, and it seems like everybody is okay with.
And we did have this.
Yes, prior.
A week or
Right.
2 ago, yeah.
okay. So which areas were you thinking about? Housing, safe spaces?
Attendance and housing, yeah.
Okay. Okay. So. Okay.
So can we add an indicator? I love your indicator charts. You know me, I'm a complete nerd about charts. Is there any way we could add one on attendance, just to see the trend line? And if we succeed in encouraging people to get their kids to school, encouraging kids to get on the bus, that it worked?
We can.
Okay, I would move that we, part 3 of my motion.
Yes,
So
I'm
you gotta
suggesting.
realize too, that, I'm sorry, I didn't mean to interrupt you, is that attendance data, school attendance data, we'd have to get,
From
the
you.
district, and they'd have to I think they could likely, I think they should be able to do it where it's not associated with the student. You know, you could see it by school.
Well, if
But
I'm
we
not
don't know if that's-
mistaken, Member Certain, you supplied us with some de-identified data before. It was at the school level, but not at the student level, and if the school district can roll that up, I don't know how you guys would show it to us. We could do an overall for the district, and then if we wanted to dive down into certain schools, we could. But I know you,
Right, but.
a school board member can request this. I cannot request this.
We had chronic absence as one of
absence, yeah.
the charts. It didn't fit neatly under any of the goals, but possibly it could fit under, maybe under health, maybe under academic.
We're saying literacy. Literacy and academic success fits there. Yep.
Okay, so part 3 of my motion is to add that we add an indicator for literacy under the literacy and academic success areas. Attendance, sorry, indicator for attendance.
Or chronic absence is the one.
It's just,
Yeah.
that's like.
Chronic absence, whatever staff, the word staff uses.
Okay. Yeah,
You
we
okay
can
with
do
that,
that.
seconder?
I bring up something else on this same page. Member Certain's point earlier about all partners and collaborators are important, but some are key and essential to certain areas. So we have key collaborators, School District of Alachua County, rightly listed first. But I'm wondering if there should be something that's about how the trust is communicating with the school board and understanding. When you go back to the literacy scan, there was a lot of talk about professional development for teachers and coherence and implementing fidelity. Do we know what's happening? If we're going to be supportive from the outside, do we know, are we communicating regularly? Joint meetings with the county commission? Is there something under implementation where there is a process that we understand what is happening, particularly with changes?
So perhaps under specific tasks, which is that first block under the implementation plan, one of the tasks is to maintain frequent and ongoing communication about these initiatives with the school board to ensure that we're working in sync.
And I also don't see anything about early learning here. Coherence. I understand, but it still builds on literacy and
So we have, are you talking about early learning and literacy?
I'm talking about literacy and academic success. Oh, I guess you're right. Maybe. Okay.
That first focus area.
Okay.
So I'd like to offer the suggestion of us putting in here that the trust does have like a dedicated, sort of like a joint meeting or convening with the superintendent of schools, whoever that person is. Like, we're really fortunate now that, our current superintendent is really embracing the literacy and getting some alignment across the school, but we got to make sure that stays. And also, because the school district is 20%. School district has two members, a member and the school superintendent of schools, and the superintendent of schools is the touch point that's going to drive and get the district to work with us. So I think we've got to memorialize the role and the working. And so for my wordsmithers, y'all maybe help me come up with something of how we encapsulate that in the plan. But there's got to be some a formalized touch point where the school district and the trust are working together, sharing data that doesn't require 29 or 26,000 parents' permission, and where the school district is really kind of leading the charge on this, on the literacy thing. That we've really got a serious touch point there to help with that. So I don't know how we frame that.
I would just say, under those specific tasks, to formalize create a formalized process for communication and coordination.
And working, yeah, communication and coordination, yeah.
Yeah. Yes. Under the specific tasks, to create a formal process for communication and coordination with the school board and superintendent. I'll agree to it. Or coordination.
Coordination, yeah.
Ready? I am ready. Yeah, okay. I don't mean to blow things up, but focus area, literacy and academic success. We've talked about preschool readiness, or getting ready for school. One of the graph should be, school readiness. When they come into school, because by third grade, we're swimming upstream.
Look at the goal before that. The school readiness goals are in that. So look at page 10 or 158. Those are the school readiness graphs.
Okay, all right, thank you. All right. Thank you. I was on the next page.
Now housing.
Where do we stick housing?
So housing,
And it's almost a similar thing, like with the school board, the housing,
Yeah, I would put it as a task, again, to collaborate with partners to address housing insecurity.
for families.
Do we need a special connection with somebody like the county housing authority? Or what do you think? can help
I mean,
us
I
with
would
it?
add them as a key collaborator.
Yeah, the housing,
The-
the city
well,
and
there's two.
county.
The Gainesville Housing Authority and the Alachua County Housing.
Right, and there's also the continuum of care, and I noticed, the continuum of care is starting to ask the, the Housing First for Children Collaborative to participate, and that's where I've been noticing that, there's not a lot of talk about families with children because they use HUD criteria for almost everything in continuum of care.
It's the only way to
So
get
on
funded.
page,
Right,
So
right, but.
So
but-
Kim, before we get into this, why don't we let staff work on it first, and then
Yeah.
we update this? Because we're coming up with this.
So it just could be that you put in a strategy of exploring what the issues.
Yeah.
So
Yep.
again, there's nothing wrong with putting something in the strategic plan that's in the future that you don't know. You just want to develop it. You don't know yet how it's gonna.
We have in there, collaborate with partners to create safe, stable home environments for children and
That's
youth.
different than housing per se. I get that, but I think you need one that is specific to collaborating on housing issues. Housing insecurity, home.
Don't forget, the definition for children is different than the definition for adults, which is why a language barrier sort of exists that we need to work at. So exploring, her wording on exploring, what are we exploring, Maggie?
Exploring, right, exploring strategies and partnerships to address housing insecurity. Yeah, yeah. Recorded, so you can always. Oh, God. Yeah. Explore, see, now I forget what I even said. I'm still 6 hours and back. Yeah, thank you.
Explore strategies to address housing insecurity for families with children. Does that sound good? Does that sound good, everybody?
I think so.
Okay.
So now we have, do you accept that amendment? And I do.
yeah, that's five. Is
That's
that number?
5?
Yeah. Good, Lee. All right, I think that's it.
Anything else?
I don't think so. I have an overall kind of, but not related to approving it, just a comment at the end if I.
So we're calling for approval this afternoon.
Right.
So we're approving with these amendments, the changes to bring to a vote this afternoon in the board meeting.
You know, as we think moving forward to marketing ourselves for a future, one of the things that I think would help with these indicators, we have the state, we have the county. I think it would be lovely if we could add a line graph for CTAC participants. Then what we show is if those families and children that participated in our programs are beating the state average, that is a plug for what we're doing. Look at that indicator graph for each of these as often as possible to create lines that say this is where CTAC participants sit.
And Maggie, who is also a data nerd like I am, I love this idea because what that can do is persuade families to participate in CTAC-funded programs,
And
right?
I think we did talk about that last time, that it's almost like on the convening role or the raising the issue, there may be things that we bring the parties together, that we help move the overall number, but then, so there are baseline, overall number, program, direct, so it's more like indirect and direct, like countywide, because we're raising awareness and the issue, and things, good things happen outside of the funding, and then direct program participants.
We're expecting miracles from staff right here.
Yeah, with the support of
I think they
our
do
new
that.
communications and the graphs, yes, that was a yes. It was a delayed yes, but it was a yes.
And Madam Chair, they gave us some information a couple meetings ago that kind of blew the socks off, you know, where it showed where a program specifically that people were involved in, the huge difference that it made. And I don't remember the program exactly, but it was pretty gratifying.
And we may not be able to do it for every single one, but that when we can, I think if we can show the difference between the state and the county and our participants, it's.
And even just the county improvement, because if you
Right.
help contribute to attendance, it wasn't necessarily a funded program, but it was raising the issue.
Well, at some point, you almost hope that the CTAC line and the county line meet.
Right. Awesome, okay, thank you so much, okay.
And can I, one last, just quick thing? Sure. People may not know how much work that last section that we just blew past is, but these two and the team have worked really, really hard, and I don't want to not recognize, because we didn't spend a lot of time on each of those pages, but that's where a lot of the other is thought and wordsmithing. This is nitty-gritty, getting down and dirty into the data and looking at what we can and can't document, so I didn't want to not
And that all happened
recognize
since
that.
January 9th.
Exactly.
When we brought that feedback at the last board meeting. February 9th, the last board meeting, then Maggie got on a ship, and she came back, and here it is. Okay.
Yeah, I barely got here.
So we did get through that detail in 15 minutes, and hopefully we're good for our next portion.
I think so. Do we need to cover those 5? You have them?
Well, the meeting's recorded, you can always go back.
Okay. All right, so then we want to
Madam Chair, do we
now.
want to vote on that motion?
Yeah, we have, do you have a motion?
Yeah, I'm so sorry. We do have a motion on the floor to
Move this forward to the.
move this forward to make those amendments and bring the amended version forward for a vote this afternoon at the regular board meeting. All in favor?
Aye.
Public comment, I'm so sorry. I get that order wrong every time. Oh, we do have Christy. Thank you, Christy.
Hi there, Chris Arrington, Executive Director of Girls Place. I hear the resounding yes for having CTAC children on the graphs, but currently CTAC doesn't ask all those questions of the children we're serving. Okay, so yeah, that was my worry for the team in general, was are you now going to have to ask all those questions of us in increasing the data that we're going to have to report?
That's why I said we may not be able to do it for all of them.
My other question, and it doesn't need to be answered, is for years there have been digging into the graduation rates of Alachua County schools, and there's a lot of data that suggests that kids are not included in that data. And so if you're just looking at the graduation rate, we look really good. And so the question being, is there going to be more transparency in the graduation rates to show the change that we really do need to make? And that's not on you all at all, but acknowledging that the rate itself doesn't appear to be accurate. And the other thing, is poverty going to be a key indicator in all of the goals? Currently in after-school and summer day camp funding, risk is not a consideration for eligibility. And so will that be considered moving forward, that the risk in some other goal areas could influence safe spaces and preventative measures?
Input, thank you, Christy. Back to the motion before us. Favor? Aye. Right, so that was great. Thank you so much. And thank you again, Bonnie and Amy, because that was a very heavy lift of the past month. All right, we are ready to move on to funding allocation framework.
Yes, thank you. And again, I just have to say thank you, Maggie. Maggie actually came over, met with the team, helped us to kind of streamline what we were going to provide back to the board. And we cannot say enough how much work and effort went into looking at the indicators, the rationale, the objective, and the strategies. So thank you again, Bonnie and Amy. Thank you, C. Robinson, for your work. Sometimes I think they thought we were crazy because we would say we were going to do one thing, we'd go back, we'd change it. But but it certainly has been a team effort. We do not take your participation in this process for granted. So thank you all again, and thank you for being here. Having said that, we are now going to transition to funding and our funding strategy recommendation. I am going to Belita as we talk about program funding. So, you don't mind?
Certainly. Okay, so to commence, I'm going to begin speaking on kind of a broader scale. And I just want to note that this is the first iteration of our funding plan for 2027, and more detailed information will be disseminated at later times. So right now we are focused on the proposed FY27 program funding allocations. Next slide. So, as you can see, and as is in your packet, we have a new sliding scale based on percentages, which is the gold standard for most children's trusts and children's services councils. And you will notice there's a comparison here between, a slight shift between the percentage allotments from the prior year as opposed to what we're proposing for this upcoming year. There is the rationale behind that is, number one, we've added a fourth large goal, but we've allotted 10% to that because ultimately augmenting the capacity and capabilities of the provider community as well as CTAC's infrastructure really does support goal 1, 2, and 3 as well. So with this shift in proposal, you will come to later see it on the next slide, partially the reason for us deciding to focus and utilize only these amount of dollars. Yes, I know percentage-wise it is not a significant decrease. However, the proposed dollar impact for the allocations is much more significant. I'd just like to emphasize that overarchingly, these are strategically prioritized programmatic allocation frameworks, which direct resource towards initiatives most closely aligned with the Children's Trust mission and measurable child outcomes, but it's also quintessential because it balances not only our community impact and program performance, but long-term fiscal stewardship.
May I pause?
Absolutely.
So can you go back a slide, Amali? I think it's important to point out the $26 allocations, you all. If you will remember when we briefly discussed percentages a minute ago, I say a minute, meaning about 3 meetings ago now, I was adamantly against percentages. And then the team kind of talked to me about the fact that, one, it is kind of best practice to use percentages. But then we started looking at what the dollar amounts that we've been funding. And the reality is we've just been out of whack with those percentages. And so if we want to ensure that we are being fiscally responsible, we have to get back aligned to what we say we're going to do. And so looking at goal 1, goal 2, and goal 3. And now, as Molly said, we've added a new goal. So I just wanted to bring that to your attention because we kind of covered it quickly.
My apologies, and my overarching intent.
Yeah.
Oh, yeah.
So if you add up,
Your mic, please.
oh, sorry. Yeah, it's 7.5 on one and 13 million on the other. And back to my every meeting question, how much of that 13 do we think is actually going to get used so that in each of those areas so that we really know what the shift is? I don't think we're going to spend $13 million in 26. So what are we really going to spend? And if that's the case, then it shifts everything for me, knowing, are we really going to cut this much from an area? I don't know that we are, because I don't think we ever really spend that much. But basically, it's almost half. Our proposed allocation is almost half, and it's more consistent with what we bring in, which is a good thing. But but it doesn't help me understand what we're really doing. I don't know, because you and I are the ones that are always singing the same song.
Do we really want to say why she's looking at you?
That's okay, because you were going to join the chorus eventually on that too.
That's why they put him over there.
I know. So I just have that question of, so it would help me understand what the shift really is in terms of dollars. And then my other question on this is, if we now have provider capacity, we used to always set aside some money for innovation. Are we considering, like small pilots, is that there, or are we looking strictly for fund balance to cover any of those? Okay. All right, thank you.
Thank you. As y'all see the numbers up there, we're spending a lot more than we're taking in because we take in about 10 million approximately a year. And that doesn't include what we spend on administration and overhead. So, the number that we have to allocate towards the various projects are, about what we have on the proposed dollar allocation, correct? And so, what and staff is working very hard to do is we need to get, as you said, Maggie, historically, we haven't spent what we said we were going to allocate or what we've allocated. But those actually are the funds that were requested. So until we get a framework where reality is what we actually spend, and hopefully we're getting to that as we go forward, because then we know what the real budget is or what we actually are going to spend during the course of a year, then we won't have to worry about the numbers looking like the numbers look. And I think that's, as we go forward, that's going to be key, and that falls on staff to come up with, you've asked for $100,000, but historically you've only spent 70. Why do you keep asking for 100? That's an issue, or whether or not they do what they say they're going to do as far as the amount that they spend, or whether, for some reason, and that falls on staff to come back with the reality of the budget. And I think, hopefully, we'll have that hammered out in the next year or so, so that we actually, what we see is what we're actually dealing with. That's going to be key as we go forward.
So to lead, kind of to your point, I'm gonna tell you, having requests being greater than what they actually spend could be attributed to a lot of things, right? So I'm just gonna speak just for AIM, because I'm their treasurer, you all know that. When they applied for the funding and things they thought they would do, good plan, and they've worked well with the trust in the past, right? But we had a change in staff, trying to recruit. We had to jumble some things around to keep the organization going. So where we've had a large expenditure in the past of mental health with our students, our mental health provider is doing executive director duties, and for insurance purposes, we couldn't allow him to do the mental health stuff, right? Because we and just being able to keep things going. So it could be something like that. I see it all the time also with the school district, in the sense of how they'll budget out, especially at certain schools. And they have every intention of doing a certain thing, hiring a literacy specialist, hiring guidance counselor. And we come back and say, well, wait, why aren't they spending money in this area? Sometimes they haven't been able to find the people. It could be in hiring staff, or it could be in something, a change and somebody quits and just the whole thing. So I want us to also, in looking, I understand us asking the question and expecting an explanation, but I want us also to have some grace on this, because we only have a certain amount of people in the community. Like Sherry Kitchens came in here, a lot of times she had an allocation to do work, but didn't have staff. It's not that it's not important and the work to get done, but some of it is dependent on, it's a good problem to have money and not have staff. It'd be something bad, and the flip is why we have the trust, so.
Tina, you hadn't mentioned anything in that explanation that staff would determine as they had discussions with the individual agencies. So, we're giving staff a lot of responsibility to be a discerner of the circumstances. And I think that they've proven to us that they are very capable of handling individual situations.
I guess I made the comment because I don't want our providers to go back and to look at this meeting, because they're not here. And they will look at this meeting, and they may start to hear us talking and to say, and we are saying a provider is requesting a certain amount of dollars, and then they don't spend it. And so then that may give them, you know, the things we say in these meetings and they get watched over, it creates panic in the provider community around certain things. And so I don't want them to, providers that will watch this later, to think that the trust staff is going to be referring to the trust members, or the trust members will start to say, well, no, we're gonna reduce everybody's budget, and we're just gonna, if you don't spend it, you know, next time you won't get X amount of dollars because you requested more money than what you spent. That's the reason why. I mean, I know staff is gonna make that, but I think we should also keep in mind that we understand that the best laid plans, sometimes you can't implement your plan the way that you intended, and it could be for some very legitimate reasons, not that you were just inflating your numbers. We do have people that, because I've seen some in evaluating, like United Way grants, and when we first started doing this, that just inflate their numbers. But there's sometimes people have a good plan, their conditions change or staff.
The dilemma that creates, though, and I agree, I mean, I've certainly been there. The dilemma, though, is we either, I mean, at some point, we can't keep allocating $13 million when we only have 7.
No,
That math doesn't work, and so I don't want to make drastic reductions and say we can only fund 5 programs instead of 8, when in fact we could fund 8 if we had a better sense of who was really going to expend and what the reasons were for not fully expending. Because at some point we just got to hit that reality of, if we're only got 7 million or 8 million to allocate to programming, how do we make that decision? I do agree that we have to prioritize by area. We can't, you know, overfund one and underfund another if they're all really key priorities. But I think unless we have a real sense of what people are drawing down, and we've now got some history. And I also think that the reality is I'm going to propose a service, and mental health is a great example. There is a mental health professional shortage in this country that is in the hundreds of thousands of personnel. So we can say we need it, but to request $100,000 when you know you're not going to be able to hire the person because, or it's going to take you 6 months to hire the person because there's just that much competitiveness for those positions. So I don't know, I'm not sure where I know that balance is. I'm loath to cut 8 programs down to 5 when we could fund 8 if we were just more realistic about what they're going to draw down.
Well, to everyone's point, it will be, as I stated originally, that this is the first iteration of the funding plan, and I am in the process and should have compiled data. I can't give you data complete from what has been drawn down in 2026 because we are currently in 26. I do have data from 2025 and 24 and prior years that we can make a comparison across goals and programs and what has been drawn down upon historically. But I think that the key point that this idea is to introduce the fact that in order to ensure that we do our due diligence and we remain strong and are able to continue to support, you know, the children and families of our community, we must ensure that the trust remains alive and well and strong and healthy itself. And that is long-term fiscal stewardship to our provider community as well. We don't ever want to feel that they're not supported, but we need to be, in my opinion, be very thoughtful responsible and that we are sustainable so that we can continue to do the work that we're doing. And if we continue to operate in a capacity that is, it's just as in a personal bank account the same way. If you spend more than you bring in, you know, you want to be able to, if something happens and we have a special initiative, have the ability to utilize that. I mean, as everyone keeps stating, these are living, breathing documents that are just propositions for the future.
Just so people think we're responsible, with the 26 budget, we actually have that money. So so please don't anybody leave thinking, and for the public watching, that we don't have that money, because we do, we have reserves. And the issue that I had with it, we were spending almost all of our reserves with this budget. We know that that probably won't be the case, but we have the money that's in there.
Molly?
Yes, okay, so then just to wrap this up, I'm just going to look at the comparison slide so you can see what the impact of the percentages or the proposed percentages would do. And, you know, you can see for goal 1, it's a slight decrease. The reasoning for this is, well, fund balance provides important financial flexibility, as we have discussed. The organization continues to prioritize a structurally balanced budget supported by recurring revenues in order to preserve assets for strategic opportunities, economic fluctuations, and enduring stability of the trust. So, to that point, more to come. This is, as I said, first iteration on the larger conversation regarding our expenditures. This was specifically directed only at the programmatic facet. I will turn this over to Belita.
Morning. To support our budget, this section outlines several recommendations designed to strengthen the trust funding strategy while maintaining fiscal responsibility and program effectiveness. And the recommendations we have three key focus areas, which is mid-year evaluations, funding periods, as well as a hybrid funding structure. Next slide, please. Under mid-year evaluations, we first implemented this in fiscal year 2025 as a part of Trust's effort to strengthen program accountability and monitoring, as well as fiscal accountability. We are currently in the process of mid-year evaluations and will bring back those contractual adjustments in April. These evaluations focus on two primary areas. First, staff review program performance to determine whether providers are meeting established outcome measures and performance targets. Secondly, staff review mid-year expenditures to ensure funding is being used appropriately and at a reasonable pace. This allows the trust to identify concerns early in the contract period and provide an opportunity to work collaboratively with providers to address any challenges. If necessary, contractual adjustments can be made to better align with program activities, budget, or performance expectations with the intended outcomes. Overall, mid-year evaluations support a stronger program management and ensure that funding is producing measurable impact for the children and the families. Next slide, please. A multi-year funding structure provides greater stability for providers. That is why you see 3-year funding for all organizations funded through an RFP. This allows them to focus on program delivery and long-term outcomes rather than annual application cycles. This recommendation is to move forward toward 3-year funding period for organizations funded through an RFP, which means that providers will be funded at 100%. However, during this period, providers will be assessed in the following areas: C&E capacity building, life cycle assessment, CQI, and research of additional funding. For the subsequent years, based on the assessment results, organizations funded may be reduced up to 25%. Keep in mind that annually, we will continue to do mid-year evaluations that may result in budget reductions. So that is where we look at where they are, what they're spending, and then they may Their budgets may be reduced, and these dollars can be reallocated maybe to a program. We did this last year with a lot of our enrichment providers, where we went through some of the program evaluations and saw that we could reduce some budgets, and there were programs that had reached their, they needed more money to provide more services, and then we were able to reallocate those dollars. Continuing. Sure.
When you say subsequent, do you mean during the course of the 3-year contract?
Both. So it could be during the 3-year contract, and then also at the end, we will look at, so if we've already funded you for 3 years and you get ready to reapply for something, that will be considered as well.
Okay, and I'm getting into the weeds, and I apologize. When you say you reduce it during the course of the time, is that because they're not spending all their money, or they don't have the number of children?
It could be both.
Okay. Okay, that makes sense. Now, subsequent funding, would y'all consider whether or not, after this RFP is completed, if they've been very successful in a case like that, and they have the demand for more children, that would necessarily, it's not an automatic 25% reduction? No. Okay, all right, thank you.
So after we had published and we read it back, we were like, well, we're not saying they would for sure have a 25%. We wanted, the point of the 25% was to say, after looking at everything, you've gone through 3 years, we've noted CQI, all the things she listed, and we don't feel that your impact was what it was supposed to be, you could be reduced up to 25% through the next RFP.
Right. So
Yes.
with explanation, that's clear now. That's what I need.
Right. And correct.
I was hoping that would answer your question. I said, I was hoping that would answer your question. Also, you see continuation funding determination. Those are those providers that were funded outside of an RFP. They would be assessed the same way to see what their funding would be subsequently moving forward. Their annual. You're already
And they were supposed to bring some money to the table or a way to expand that. So I haven't forgotten that yet, and I haven't heard that from them yet. So go ahead.
So the next slide is recommended for hybrid funding structure. The step one in this structure is, the first step of the hybrid funding model is a fixed award pool. This means that the RFP operates within the predetermined funding allocation that cannot be exceeded. Programs are ranked based on final evaluation score using the approved rubric. Awards are issued to the highest scoring proposals until either the maximum number of awards is reached or there are no additional fundable proposals. For example, if an allocation is $2 million and the maximum award amount is $200,000, the trust can issue up to 10 full awards. The structure creates, I'm so sorry. The structure creates a clear funding ceiling and ensures that total expenditures remain within approved budget while prioritizing the highest performing proposals. The second step, next slide, please. So the second step is, if fewer than the maximum full awards are issued, what will happen is that we will determine the remaining available funds. And it applies only to qualified unfunded proposals who maybe did not rank in those top 10, as the example I just gave. And then we will do a potential impact analysis. Based on the remaining funds, we will look at what we could actually do with those funds that will make an impact. If then that will lead to the decisions below. We would either divide by total requested amount of qualified proposals. We could redistribute remaining funds into top ranked programs that will allow them to serve more children, or require revised budgets and scopes for those, whether it is one or two at the bottom, and then unexpended programmatic funds reallocated to CTAC's reserve. Next slide, please.
It's our current, the way we currently do funding, correct, isn't it? Like the RFPs are scored out and then.
Yeah, we current,
and
yeah,
then-
that part, but we don't do the second step. Oh, and I do want to say that what would be new to what we currently do is we would have a maximum number of programs that we would fund. So if the allocation, as I said in that example, if the allocation is 2 million, that means we only can do 10 programs, and they can go up to a budget of 200,000. So for the strategic rationale, the funding recommendations that I provided are designed to support both programmatic effectiveness and responsible financial management. The model ensures that the highest ranking programs receive full funding, reinforcing a performance-based funding approach. Second, the fixed award structure maintains fiscal discipline by ensuring that the total expenditures never exceed the approved allocation. And finally, the strategy aligns funding decisions with program performance outcomes while also considering staff capacity to manage and monitor the funded programs. Thank you.
Thank you, Madam Chair. Okay, so what y'all's are proposing is that we have so much in a goal, say $2 million in your example, and they're gonna be, you can't exceed more than $200,000, and that's gonna be how we allocate the money. You know, don't submit, you can submit a budget, but it can't be more than $200,000. So theoretically, you could have more than 10 programs if they were only asking for 70,000. So we still may serve more, but this is how we're gonna do it as opposed to what we've been doing. Okay, that sounds good.
And not necessarily the goal, you said the goal, but it's whatever allocation we've made to that initiative for that RFP.
Would the max amount always be 200,000, or is it 10%? Like, because I'm sitting
Oh,
here like.
no,
so-
I just gave that as an example. It just we would determine what it would be so that we wouldn't go over whatever the allocation is. Then we would determine how many programs we could fund within that allocation, and that would determine the amount of programs that we would, for that particular initiative.
So it would come to you first, right? We would be bringing to you, we bring every RFP to you to be approved. We would bring to you the funding allocation, how much money we have for that initiative. That then would determine how many organizations we would be able to fund out of that, and all of that would be in the RFP that we would be releasing to the public.
Madam Chair, I would say that y'all have figured out a way to rein us in. And that is, you know, that here's the way of doing it. And I think that it's very commendable because it theoretically, it takes a lot of the pressure off the board because there are all these proposals out there and they all sound good. You put out front to everybody, this is what we have to spend, and submit your proposal. So this sounds like potentially it could be a solution to the issue. So thank you.
So, I'm kind of trying to align with Lee, right? But this is what I'm hearing, what I'm recalling in my mind of happening. Like, we had the mentoring one, remember? And we had that list, everybody made their requests, and we just, like, they had them ranked by their RFP score, and we just went down and we had that cut line of who got funded and who didn't. I like the rationale. I guess for what I don't want people to do is to be inflating their budget though, because then you got people that may be in that line, up above the cut score line, and they may get an award and then they might not spend it, or so I don't know.
So during the review process, we look at if their budget makes sense.
Like if it's reasonable?
Yes, if it's reasonable, and we have and that conversation then goes into like a contract negotiation, and where we say, okay, I know you asked for $100,000, but I think you may be able to do it with 75,000 based on based on the negotiation and what we have reviewed during the application process. So usually that's where, when we're reviewing, we can tell if there is an inflation or not, and that can be adjusted before the contract is awarded.
But is that before the recommendation is made to the board or before the contract is awarded? So you, there's still you would do that same process, I mean.
But it'll be, but in the plan, that remaining money then can then be redistributed to those providers that did not make the cutoff.
Initial cut, and that will be done early in the process, not like 6 months
No,
later. It'll be
early in
done
the process.
early in the process, like shortly after
Shortly.
the,
After the determinations are
and-
made.
okay.
Real quick, I like the thought. It sounds really great. I would just ask one question. On our focus area that we talked about, how does staff do that agencies with diverse funding sources exercise, which is agencies need to maintain multiple funding sources to reduce reliance on a single revenue stream?
So if you all will remember, part of our new strategy is capacity building, and we have contracted with the Center for Nonprofit Excellence. So our life cycle work will be the assessment. They will be working with CNE, I keep calling them CNN, CNE on those kinds of things. One of which is to determine where additional funding might be located. I hear you, Maggie. We know federally things are not as diverse as they used to be, but it will be a part of every provider's deliverable that they are applying for grants, seeking grants, looking for outside revenue sources. Now, there's no guarantee they will get them, but we do want them to go through the process of finding grants, applying, because that's building their capacity, and hopefully it's helping them build their sustainability.
So I would say I like what Commissioner Pinkison said, reining us in. I really like the idea of, if you're not using it, we're going to reallocate those to those entities that are producing outcomes and are effective. And I want to incorporate into the RFP, I just want to understand that question that I just had for you, which is, are you 100% relying on the trust, or are you, what do you look like as an organization? So, thank you.
To speak to that point, we do currently ask if we are the sole funder of any organization or program, and we do, in their budget process, there's a portion that is requested from CTAC and shows funded from other sources.
Yeah, but just remember that diversification of funding, you may be the sole, you may not be the sole funder of an organization, but you may be the sole funder of a particular service within that organization, which they would not be able to continue to provide without your funding. So
I just have a quick hypothetical question, and staff would be able to answer this based on their experience, I hope. In the example that you gave us, we have $2 million. We're going to put out an RFP. We're going to accept 10 proposals at $200,000 each or so. What if you have somebody with extraordinary capacity that says, I could do $400,000 worth for you, and you know that about me because you have my history. What do you do then?
I think we would come back to the board, and that would be a board decision to make.
Comments from the board, or?
The only major issue we're gonna have is when we submit those RFPs and the top 10 get it, and there are 10 people out there saying, you funded us previously, it becomes incumbent upon us to have the courage financially to say, we can't do that, or, and go from there. That's played out before, so.
Last 5 minutes, and we are not acting on this, or are we acting on this framework recommendation?
Correct. This was our recommendation. We wanted to bring it forward because board members had been asking us. More to come, of course, as we look more into it, as we start preparing specifically towards budget. But this was our opportunity to say to you, this is how we see strategically our strategic plan, how we will be funding, what we will be bringing forward to you all in terms of RFPs and the like.
Madam Chair. For staff support, I would recommend, I would go ahead and move that we adopt the program funding strategy that staff presented today.
All right, any members of the public have a comment on what you've heard with the funding strategy? Christy?
Hi there, Christy Arrington, Executive Director for Girls Place. I appreciate Mr. Pinkeson and his point, if you remember summer day camp, that there were some really good performing agencies that did not write great proposals. And so you all went from initially funding, I think, 15 agencies to 30 agencies. And so I caution that the capacity building will be as impactful within a year with those agencies who don't know how to write a good proposal. So just keeping that in mind.
Ross Ambrose. I guess I like the proposal you're going forward with. It seems that's fine. The rubric, I think, might need to take a little look and see what you might be able to adjust in that, where something in a rural area or where Children's Trust Fund isn't being done and there's a proposal, that gets a little maybe extra weight so that the funding is being spread out. Okay.
That is a criteria, and we,
Because I would think if you only have 2 programs being submitted in Waldo or La Crosse or High Springs,
there is
is it enough that they actually could rise to the top if they're actually producing results? That's the question, not to be debated. I understand there's an additional balance there, but is it enough where a small amount of money might actually get allocated to that area?
excellent. Thank you so much, Molly and Lita. And yes, we do need to vote on adopting this funding program strategy framework for going forward and implementing the strategic plan once approved. All in favor? Aye. Any opposed?
Cautious.
Carries. 2 minutes early.